I am so excited to finally be filming this video for you guys. As a lot of you know, I have been going to physical therapy once a week for an hour session just to help strengthen my pelvic floor for labor and postpartum. I am now 33 weeks and 2 days, and I can tell you that this physical therapy has been a game changer. I have been learning so much from this physical therapist about my pelvic floor because before I started going there, I didn't really know what the pelvic floor was. I didn't really know anything about the pelvic floor. So now I get to tell you guys everything that I've learned from my physical therapist and some exercises that I've been doing every day to help strengthen and prepare my pelvic floor for labor and postpartum. And of course, I have to say this disclaimer, I am not a professional, I'm not a physical therapist, I have no certification in this field. I am just merely wanting to share with you guys everything that I've learned in hopes to empower you with more information if you want to pursue any type of pelvic floor work with a professional, or you want to pursue something along those lines to help you out in your own pregnancy, or if you're looking to get pregnant in the future, maybe this will give you some ideas on how to better take care of yourself. In this video, I'm going to explain what the pelvic floor is, what the importance is of having a healthy pelvic floor, especially when it pertains to pregnancy and labor and delivery and postpartum recovery. And then I'll go into the different exercises that I've been doing at home. And then I'll close out the video by sharing with you guys how so far this pelvic floor work has helped me. By the way, if you are brand new here, welcome. I upload every Sunday morning, 8 a.m. Pacific Standard Time, all about living healthy and IVF. If you are a returning subscriber, thank you so much for coming back and watching, and I hope this video helps you. Okay, so what is the pelvic floor? When someone says the pelvic floor, what are they referring to? Well, they are referring to all of the muscles between your tailbone and pubic bone. So there's a lot of little muscles that help hold up the bladder and bowels. And in females, these muscles also hold up the uterus and vagina. And before going to physical therapy, I really had no idea that there were so many little muscles that hold up all these vital organs down there, which makes total sense because when people talk about bladder prolapse or leaky bladder, or they're not able to hold their pee, they're referring to these muscles being weak, and these muscles can't support those organs. So when it comes to pregnancy, these muscles have to work even harder to support all the weight of the baby. And pregnancy hormones tend to soften those muscles as it is. So they have to work even harder from the weight of the baby, plus all the hormones that are softening them already. So pregnancy puts us at high risk for urinary incontinence, losing control of our bowels, inadequate emptying of our bladder when we go pee, so we can't go pee all the way. And on top of it all, pregnancy puts us at higher risk for developing pain, pubic bone pain, pelvic pain, hip pain, all that kind of pain down in that region. But it doesn't have to be that bad if you have a healthy pelvic floor. So if you have a healthy and strong pelvic floor, these symptoms could be very minor, or you might not even have them at all during pregnancy. Which leads me into explaining all of the benefits and the importance of having strong pelvic floor muscles during pregnancy. During pregnancy, these pelvic floor muscles are at high risk of suffering damage from all the way to the baby. So if you keep them strong and if they're healthy, they will suffer way less damage, or maybe no damage at all. So you won't be suffering from any urinary incontinence, bowel incontinence. You'll probably suffer way less pelvic pain, way less back pain, hopefully none at all. And then here's the kicker. A lot of research has shown that if you have a strong pelvic floor, your labor and delivery is way less risky. It's way less risky because your pelvic floor is strong, so you can more efficiently push baby out, puts less strain on the baby because you're able to more efficiently push the baby out. So therefore, having a strong pelvic floor will decrease your risk of having a lot of complications during your labor. Not only does a strong pelvic floor help with labor and delivery, but it also helps speed up recovery postpartum. The research has definitely shown that if you have a strong and healthy pelvic floor, that will speed up your recovery process after you give birth. And that's because when you have strong pelvic floor muscles, there is more healthy blood flow to that region, speeding up recovery, decreasing bruising and edema in that area, and ultimately helps you regain control of your bowels and your bladder. And it just overall helps with the healing process when those muscles are healthy and strong. And I am all for speeding up the healing process after I give birth, because you guys know me, I'm a super active person. I love my workouts, and I really want to be getting back into my workouts as soon as possible, as soon as I get cleared by my OB. And I just want to give my body that opportunity now to strengthen everything so I heal faster after I give birth. Okay, so let's get into some very simple exercises that I've been doing that I've learned from my physical therapy to help strengthen my pelvic floor and that you can also do at home. These are super simple, and I always do them after my workouts as a cool down. So I've been doing these exercises about 4 times a week. The recommendation is to do them every day if you can, but I just forget to do them every every day because I don't work out every day. So I just do them after my workouts. Before I get into the very simple different exercises, some people have been asking me through Instagram when they should start doing these things. And the recommendation is as soon as possible. Actually, as soon as you find out you're pregnant, you should start looking into doing some exercises to help strengthen your pelvic floor. I didn't know anything about this until a friend told me that she was doing it. And so I didn't start doing any of this until I was 26 weeks, but I wish I had started earlier. Okay, so the main exercise that you want to do to help strengthen your pelvic floor is to do Kegels. And so there's different various body positions you can put yourself in to do Kegels, which I'll get into, but I want to go over how to properly do a Kegel because that is the one exercise that will really help strengthen your pelvic floor muscles. If you're watching this video and don't know how to do a Kegel and want to practice as I explain how to do it, you can go ahead and try a Kegel, but when you try it, go ahead and stand up in a standing position because I think when you stand up and try to do a Kegel for the first time, I think we've all done Kegels as it is because it's a natural response when you have to go to the bathroom or whatever, but when you're trying a Kegel like consciously for the first time, I think it's the best to stand. Doing a Kegel is very simple. All you want to do is concentrate on if you are needing to go pee and you're trying to hold it, to contract those muscles when you're trying to hold your pee in. And that's kind of how I think of it. Some people think of doing a Kegel as trying to like lift up that bladder area. I don't get that complicated. All I can focus on is if I imagine myself having to go pee and trying to hold it in. So you're contracting those muscles to hold your pee in. You can also think of it as a way of contracting your muscles if you have to have a bowel movement, if you really have to have a bowel movement, or if you're trying to hold in gas, you're contracting those muscles. So it's the same muscles as if you're holding in your pee or as if you're holding in gas. But the key is when you're contracting those muscles, you don't want to contract any other muscles. So you want to keep your abs relaxed, you want to keep your glutes relaxed, your bottom muscles relaxed. Everything else needs to be relaxed. All you're contracting are your pelvic floor muscles, the same muscles that you use to contract when you have to go pee, when you're holding in gas. So you just want to isolate contracting those muscles by themselves, not any other big muscles around that pelvic area. So no, like I said, no glute muscles, don't contract any other muscles, no ab muscles. What I was having trouble with when I was doing Kegels for the first time was my lower abs would contract. And so I had to concentrate on like putting my hand on my lower belly and making sure that those abs don't contract when I do a Kegel. You just want to make sure no other muscles are flexed when you do a Kegel. Only those muscles that you use to prevent urine from coming out or gas or poop. So if you're doing a Kegel for the first time, what you want to do is when you're standing up, contract those muscles, those pelvic floor muscles, just for like 2 seconds and then release. And then maybe like wait a few more seconds and then contract again as hard as you can for 2 seconds and then release. And that's kind of how you practice. So that's actually the first exercise that I do after my workouts is just the standing Kegels. The quick contractions is what they call them. So you just stand in a neutral position. You kind of want your feet hip width apart. You don't want them like super wide apart or like really close together. You want them hip width apart. And I always put my hand on my lower abs just to make sure my abs don't contract when I do them. And I do a quick Kegel lasting about 2 seconds as hard as I can and then release for a couple seconds. And then do a quick contraction for 2 seconds as hard as I can and then release. So I do that 6 to 8 times and I do 3 sets of those. And then I take like a minute or 2 break and I do this same thing again, but with this second exercise, you're gonna be holding the Kegel longer. So I hold a Kegel for about 10 seconds. So these are called standing Kegels with a long hold. So what you'll do is you'll do the same thing, but you'll hold the Kegel for 10 seconds. And I don't hold the Kegel like super strong like I did the quick Kegel contractions because I can't hold it for 10 seconds and be like maxed out on the contraction. So what I do is I do a Kegel and I hold it for 10 seconds, but it's a little bit more less contracted because like I said, I can't hold it like a full contraction for 10 seconds. I'm not that strong yet. So I hold the Kegel for 10 seconds and then I release for a few seconds and then I do it again. I do a long hold for 10 seconds and then I release. So these long holds really do strengthen the endurance of those pelvic floor muscles, whereas the quick contractions kind of strengthen them in a different way. But holding it for a long time really does help strengthen them over the long haul and kind of like improves their endurance. So I do long hold Kegels. I'll do 6 of those and 2 sets. The third Kegel exercise that I do is on all fours. So you get on your hands and knees. You want want your wrists directly over your shoulders and your knees over your hips. So you're in a tripod position. And then what you want to do is take a deep breath in through your nose. And when you take a deep breath in, you want to relax all the muscles, all your tummy muscles, abdominals. You want to expand your rib cage as much as possible. So you take a deep breath in through your nose as deep as you can. And then you'll exhale through your mouth like you're blowing out candles. And as you exhale, you pull in your belly button and you do a Kegel at the same time. And what this does is it engages those core muscles that you need when you push baby out, but also, of course, the Kegel is strengthening the pelvic floor muscles. So you're strengthening both at the same time, which is pretty cool. So you want to take a deep breath in, relaxing all your ab muscles, relaxing your belly, and blow out like you're blowing out candles. As you're blowing out, you're gonna pull the belly button in. So you're contracting your belly button and pulling it in, and you're doing a Kegel at the same time. And I'll do that 8 times, and I'll do 3 sets of those 8 times. Okay, so the last exercise that I do is actually not a Kegel. And I have to look at my notes because I always forget the name of this exercise. It's called quadrupt transverse abdominis. So this is a different type of exercise that also strengthens the pelvic floor, but in a different way. And it's not a Kegel. What this exercise does is it helps strengthen those core muscles, those ab muscles, to help push baby out. As you grow, you know, your abs on the front separate. And so those abs can't be engaged when you try to push baby out. The abs that are engaged are the ones kind of on the side, more internal abs. And those abs are called the transverse abdominis. And those are the muscles you want strong and engaged to help push baby out. So in this exercise, you'll be on all fours again. You'll take a deep breath in like you did the previous exercise, in through your nose, relaxing all the abs, expanding your rib cage. The difference on this though is when you blow out like you're blowing out candles, you're gonna keep your pelvic floor muscles relaxed. You're not gonna do a Kegel. What you're gonna do is you're gonna focus on pulling the belly button in and tensing those abs as you blow out the candles. This exercise activates those transverse abdominis core muscles that you'll need to push the baby out. This exercise solely focuses on labor, especially the last stage of labor when that head is crowning and you need to push that baby out. This exercise teaches you how to engage those core muscles, engage those internal ab muscles, and at the same time relaxing the pelvic floor so that head can come out and the baby can get delivered fast. Because you don't want to be doing a Kegel while you're trying to push the baby out. Of course, you don't, that's counterintuitive, counterproductive. So these Kegels are really important to strengthen the pelvic floor, but when it comes time to actually get that baby out, you need to be able to relax the pelvic floor muscles and engage the core muscles to push and successfully push him or her out. So I will also do 8 reps of this one, 3 sets. All right, and that's it. Those are the 4 exercises that I've been doing almost every day to help strengthen my pelvic floor, help prepare my body for labor, hopefully speed up the healing process postpartum. Please let me know if you want me to go into more depth of other things that I've learned from my physical therapist, because I've been dealing with some groin pain, little bit of hip pain, middle back pain, and I have learned a few exercises and stretches to help with all of that, because as baby is growing, I'm noticing more pelvic pain, which I know the Kegels help strengthen the pelvic floor, but there are other exercises that I'm doing now to help strengthen my glutes, my butt muscles, to help stabilize the pelvis as I'm getting larger. And then for my back pain, especially the middle of my back, it's because my belly is growing so much that the weight of my belly is pulling on my middle of my back. So I have some stretches and exercises I've been doing to help strengthen all of that, and also different pillow positions on my bed that I found are helpful for back pain. So let me know if you guys want me to do a follow-up video on other things I've been learning to help with aches and pains of my 3rd trimester. In conclusion, I have found that doing these exercises almost every day has really helped me. I noticed that at 26 weeks when I started doing all of this stuff, I had a little bit of like bladder incontinence, especially when I sneezed. I think it was around 25 weeks, I sneezed and like pee came out, and that's never happened before. And I was like, oh, what is going on? I need to take care of this. And so I haven't had any of that since. I also just love how simple and easy these exercises are to do on a daily basis. It doesn't require much time at all, and they're super easy. You can just do them when you're brushing your teeth or combing your hair or doing like whatever you need to do during the day, as long as you're not walking around. You can do Kegels. So I love how practical they are. I thought that maybe like preparing my pelvic floor for like labor and delivery and postpartum would be like such such a process and it would be like super involved and complicated, but it really is not. It's very simple. So yeah, you guys can start doing them at home if you want to. Of course, I always say check with your healthcare provider, but Kegels are like one of those basic exercises I don't think you can go wrong with. But of course, always check with your provider with everything that you're doing, especially if you're pregnant. I also want to say a huge thank you to you guys who commented on my last video. I really opened up my heart and became very vulnerable to you guys, telling you what it was really like to become pregnant after over 10 years of infertility and IVF and not believing the pregnancy and all the emotions and mental battles I fought, especially the first half of my pregnancy. And where I'm at now mentally, I'm doing much better this week, by the way. Last week, I just kind of had a mental breakdown. You know, last week I was 32 weeks and I was like, oh my gosh, it's happening. And because I wasn't believing the pregnancy for so long, it kind of hit me all at once that I was so behind. This baby's coming. I didn't have anything done. And I kind of was forced to sort of believe everything at once. You guys were just so encouraging. I really appreciate all the love, all the support. I hope that I'm giving the same back to you guys. Let me know your thoughts on this video. Give it a thumbs up if you liked it, if you found it helpful. And of course, hitting that thumbs up button really does help support my channel, helps me in the YouTube algorithm so that more people can watch the content and learn hopefully and be encouraged by all of these things that we go through. Love you all. I'll see you in the next one, and always remember to be kind to yourself.